blepharoplasties are fantastic for treating both the upper eyelids or the lower eyelids, or very commonly a combination of all four eyelids. And in the upper eyelid, it's fantastic for treating hooding of the eyes. So this photo is demonstrating sort of age-related hooding. So you can see the patient on the right has got skin that's spilling over the eyelid itself and is starting to rest on the cheek. And oftentimes we see that it's pressing down on patients' eyelashes. And in the most extreme cases, it can start obstructing what we call their field of view. So people become unable to see anything above the axis of the eye. And I do get referrals through from opticians where patients have been to see the optician and complain that actually they've got blind spots, but the blind spot, their inability to see things up here, is because of the excess skin that's coming down and resting on their eyelids. Patients complain about friends and colleagues or relatives telling them that they always look really tired or they always look really grumpy, which doesn't match the way that they're feeling, and it ends up being their eyes that's responsible for it. And then the operations for lower eyelids are really good for removing lower eyelid bags and tackling thin, crepey skin. So that's what we'll be talking about now. So essentially, a blepharoplasty is removing, like nearly everything that I've been talking about today, removing excess skin and excess fat and tightening things back up again. So in the upper eyelid, there's a small incision that's made all the way across the upper eyelid, but that scar heals fantastically and nearly imperceptibly because it just fits into the natural crease where your eyelid meets the fold that comes down over it. Occasionally we have to extend it slightly further out to the lateral side here, but again that scar nearly always disappears really nicely in just the normal skin creases that everyone has there. When we're targeting the lower eyelid, I think this isn't quite demonstrating here. So when you're targeting the lower eyelid, the access and incision is just underneath the eyelashes. So it's so close to the eyelashes that the scar again completely disappears. And then through that, we can target bags, we can remove skin. It's a really fantastic technique. Treating up our eyelids on its own is something that we can easily do under local anesthetic, and it takes less than a couple of hours. People are in hospital for a morning or an afternoon, and then they very quickly get on back to their normal lives. If you want to have all four eyelids treated or your lower eyelids, then actually that's nearly always done under a general anesthetic, which just means you're in hospital for a little bit longer, but it's still all day case surgery. These are not my photos. I've actually borrowed these from a West Coast American surgeon, just demonstrating what people should expect. Because I've said it's very quick in and out surgery, which it is, but actually you do have a couple of days of swelling afterwards. And so if you are someone that wants to avoid anyone knowing you've had this sort of surgery, this is the surgery that we most commonly do on something like a Friday, and on a Friday, Saturday, Sunday, you'll be quite swollen, but by the start of the next working week, it will be starting to settle down again. Okay, that's what it's demonstrating. So there is quite a lot of swelling here, but very quickly, you're back to where you are before. So we'll have a few before and afters just demonstrating the sort of things we've been talking about. So we're talking about upper blepharoplasty here, and you can see that this patient has had a lot of excess skin removed all the way across from here. So the skin that was sitting, resting on the eyelashes and pushing them down has been lifted away, and actually the scar is completely hidden away under that fold that's there. And a very similar thing for this patient. So this patient also had quite a lot of medial skin here, which is relatively unusual, but the skin that's over towards the nose side of the eye. And we've taken all that away and taken away this lateral stuff here, really completely opened the eye here, really rejuvenated the eye, and left someone with scars that you wouldn't know. And actually, if you didn't know the patient beforehand, there would be no real signs this patient had had this sort of surgery in any way. This is demonstrating someone who's had upper blepharoplasty, so you can see exactly the same thing. So all of that hooding of the eyes has been lifted off, everything's been evened out. But the other thing that this patient was specifically asking for is something called a canthopexy. So it's where we tighten the lower eyelid a little bit. And if you look at this photo on the left, the before photo, you can see that we're starting to see the whites underneath this patient's eyes, which is because of laxity and age-related changes in the lower eyelid. And it's a really aging thing for people to see, and they can dislike it. So a little minor procedure just to tighten things up and bring that across will also have the same result of rejuvenating the patient as well. So this is combining upper blepharoplasty, which we've already talked about, I won't go over again, with so what we call a mid-facelift. So this little incision all the way across here, underneath the eyes and out this way. And you can just see there's a tiny hint of a redness here still, but that'll disappear with a little bit of time, has allowed us to really target this bagged area here. So this deep groove that's in here, and this deep water-filled and fat-filled bag that's sitting here has been completely emptied out. And the what we call the nasojugal junction here, so the normal, the skin between your cheek coming up onto your eye here, is now one nice, smooth, rejuvenated line here, rejuvenated curve, rather than having this deep trough running through it there. So that's a mid-facelift. And this just demonstrates that actually sometimes this surgery can be really, really complex in many ways. So this patient's had upper and lower blepharoplasties. She was most bothered by her lower eyelids, which you can see have got this really common, very thin, crepey skin that's been emptied out. This is actually very commonly seen in people who either smoke or have previously smoked a lot. But actually, she was really bothered by her previous asymmetry. So if you look at this eye here, the eyelid on this side is completely different to the eyelid on this side, which is something that had bothered her whole life, but she never sought any treatment for it. And it was only when we came to discuss her lower eyelids that she mentioned this, that actually it's very simple to start targeting her upper eyelids, and as well as rejuvenating them, trying to give her a much more symmetrical appearance to her eyes. So this patient was extremely happy.